with the space that's between the two of you. The issue of touch requires much sensitivity. Because healthcare is a hands-on profession, it's our daily practice to touch people often and intimately. However, we must constantly be aware that touch has many meanings for our patients. It may indicate such things as agreement, caring, love, and even sexual desire. Many patients are hungry for a hand grasp or other form of touch and will demonstrate this by reaching out. If you've been in a gathering of senior citizens and someone brings a pet in, a dog or a small child, you'll notice that many of the senior citizens will reach out and try to have some contact with either the pet or the small child. Have tremendous needs for touch that may not be met at that time in their lives. Most desire or feel neutral about such touching as a pat on the shoulder during the course of normal conversation. However, patients who have been physically or sexually abused tend to see uninvited touch of any kind as a boundary violation. People also of the Islamic faith find touch by someone of the opposite gender very offensive. If a client has not indicated a specific desire to touch or be touched, you should determine their feelings about touch before using it. Rule of thumb usually is always ask before touching. It's easy to ask, "May I touch your arm?" Or in another situation, you might say, "I would like to give you a hug. Would that be okay?" Touch has different meanings and therefore may soothe or could irritate and cause someone to bristle. It must be used carefully based on the patient's needs and wishes. The use of humor as a therapeutic intervention is not a new idea. Florence Nightingale, considered the mother of nursing, recognized the connection between mind and body long ago. She recognized the importance of humor as a skill for a caregiver and used it herself. Humor can assist in establishing a relationship because it helps break the ice, decrease fear, and establish trust. Humor is a means of sharing. Thus, it can be used to strengthen relationships. It's imperative that the caregiver be sensitive to the patient's interpretation of humor. Humor is defined to a great extent by one's cultural background. To determine appropriate humor for an individual, it's important that you make note of the type of humor that the patient uses and the things that make the patient laugh or smile. For example, if you used sarcasm, for example, saying, "You know, if you don't get off your butt, you're going to be glued to it," that might be motivating for some person to exercise, but for somebody else it might be a real insult. So be sensitive to the type of humor that the individual embraces. Humor helps individuals to relieve stress, to express anger, and is a powerful tool for coping. Caregivers turn to humor often as we have to carry on life and death situations every single day at work. Although humor can relieve tension and stabilize high-stress situations, it must be used with caution. It can be dangerous and destructive if used carelessly. Healthcare providers should always presume that a patient and a family can hear their comments. One time I worked in a hospital and we had a patient that was close to the nurse's station and close to our break room who was dying. As her health declined, her husband spent more and more time at her bedside, to the point where he was spending almost 24 hours a day there. And as a result, as he saw his wife declining, he was becoming more and more sad about the situation naturally. He'd gotten to know the caregivers very well, knew most all of us by name, all 3 shifts. And after she died, he came to me and he said, very despondently, he said, "I just can't understand it." He said, "They seem to care so much about my wife." But he said, the minute they'd leave the room, they'd head into the break room, have something to eat, laugh with their friends as though nothing was bothering them. He was at a place where he couldn't understand how caregivers needed to use humor to diffuse some of the stresses of a caregiver's day. But knowing that it would have been important that the break room be a place where caregivers could have that kind of humor, but not within earshot of patients and their families. Throughout every situation, listening must occur. Listening involves paying attention. It's something that you have to do actively. It takes work to actively listen to someone. A good listener encourages the speaker to continue. Responses such as, "Go on," or "Oh yes." Those kinds of remarks indicate that not only is the individual listening, but they're thinking about what's being said. Sometimes a gesture like a nod or a smile can also convey that message. Have you heard the phrase, "in one ear and out the other"? Well, that's a phrase that talks about not listening to an individual. We all have experienced talking to someone who we know is not listening to us very carefully. They may have their eyes downcast in a magazine, or they may have one ear listening to TV or watching television while we're talking. And the message that's being conveyed is that what we're saying really is not that important to them. There are some problems that interfere with listening. Some people listen selectively. That is, they hear only what they want to hear, or they hear what they think the message is going to be. Listening can be a healing process. We all have a need to express our ideas and the need to be heard, and so it's very important that you actively listen to your patients. Sometimes you'll have patients that don't want to talk. Sometimes they aren't able to talk, or sometimes it might be a situation that they don't have the energy to talk. That does not mean that they don't want to have someone close to them. Sometimes the best thing that we can do is to offer ourselves. Sometimes the best interaction is silence. You can say something like, "It's okay if you don't want to talk right now, but if you'd like, I could stay with you for about 10 minutes. Offering yourself may be exactly what an individual needs in that situation. Therapeutic interactions between caregivers and patients can bring a great deal of satisfaction for both of not only the caregiver but also for the resident. The most effective tool that we have for developing meaningful relationships is not some sophisticated piece of equipment, some machine that has lots of whistles and bells, but rather it's ourselves.